Hi, everyone. Good evening. My name is Athena Girbellini, and I'm the proud president of Hope for HS, as well as a board member for the HS Foundation. Let's get to our speaker, Dr. Raja Simavani. Then we will meet back here at 7:50 for a live question and answer session. Dr. Simavani is a board-certified dermatologist, bioengineer, and Ayurvedic practitioner. He practices at his medical and surgical dermatology clinic at the Pacific Skin Institute and his integrative research, aesthetics, and wellness clinic at Zen Dermatology. He serves as the Director of Clinical Research at Integrative Skin Science and Research and in the Department of Dermatology at the University of California, Davis, as well as the co-director of the Microbiome Research Initiative at the California State University, Sacramento. He merges modern research and science with a personalized approach to each patient. His training is in Ayurvedic medicine, lets him take a more humanistic approach to patient care, science, and research. Dr. Simavani has over 120 peer-reviewed publications and a textbook on cosmeceuticals. He leads many clinical studies that focus on the impacts of food, nutrition, botanicals, cosmeceuticals, and the microbiome, and the gut-skin axis, as well as studies on standard Western medications and devices. He serves as one of the lead editors for LearnSkin.com and is a chair of the annual Integrative Dermatology Symposium. Thank you for joining us, Dr. Simavani.
Thank you so much. It's a pleasure to be here, and what an awesome summit that you've all put together. I'm very excited to talk to you about some of my experiences with treating HS and just some of the things that I've learned along the way that have made a big difference in how to enhance that doctor-patient communication. So today we're going to be talking about the psychosocial impacts of HS. And this is, of course, probably one of the nearest and dearest parts. You know, it's one thing to treat with medications. It's another thing to treat with, say, whatever kind of interventions we go through. But I think when you think about the psychology of this condition and really being able to connect with another patient about this, I mean, this is really where it matters the most because it's what makes you feel heard. And also, as a physician, I think it's what makes you really feel connected to the patient. So let me get into what we're going to do here. So first of all, I'll just talk about some of the research in this area. And, normally I give this talk to try to help other doctors think about how to connect with their patients. But I think this is a little different. I mean, it's going to be practical tips, but I want to talk to all of you that are patients or perhaps have loved ones that are patients about how to really make that connection and see, where the research is and how to make a better connection so that we take all this theory and we can all learn together, because I've learned so much from my patients as well. But let me start off by saying, if you look at what dermatology means, and this was one of the reasons that I went into dermatology. In fact, it wasn't because it was just the skin condition, because we know these skin conditions, and it's not just HS. You look at psoriasis, vitiligo, if you look at hyperhidrosis, and by the way, hyperhidrosis was the very first patient that inspired me to even go into dermatology. When you look at all of these conditions, it becomes quickly apparent that this isn't about just the skin. It's about how you interact with the world. It's your social interactions. It affects your psychological state of confidence, perhaps, whether it's going to be the clothes that you wear or just simple things like how you might even interact with another person in a social setting. Will you date? All of these things are so important. And I think they have lasting effects. Even when the disease and the condition gets better, the psychological impact can be lasting. And so I think it's really important to address that too. And sometimes we just focus on the skin. So today, what I'd like to do is talk about the psychological impact of HS and what you can ask your doctor or your healthcare provider, and then the social and sexual impact of HS too, just to outline that so that everybody is on the same page. And it's really important for physicians to know about this and practitioners, but also patients to know about this, because it's okay to bring this up to your doctor, because one of the things that comes up is embarrassment. And I'll talk a little bit about that with research. But let's start talking about, what does psychosocial impact mean? If you look at the stages of psychosocial development by Erik Erikson, they lay out during all these ages, what are the little psychosocial crises that you're trying to work out What is the virtue that you're trying to gain? And at what age group are you doing this, along the way? And, when you think about HS, a lot of that impacts people in this 12 to 40 to 65 age range group. And this is where you're really developing your identity. You're trying to make sense of how you fit in, how you might be important to the world. And then this whole notion of fidelity is just basically, okay, I have this importance, and this is a way that I can contribute to the world. And when you're going through something like HS and you're still trying to figure out where's my identity, and also it spills into this whole intimacy versus isolation, you end up on the side that isn't so nice to think about, which is role confusion or isolation, because you don't have that connection, or you don't feel that sense of connection as much. And all you need to do is, feel a sense of, oh, I can't make these connections, or I feel embarrassed to make these connections. And then it can have lasting impact even into your adulthood. So I think it's really important to just, pay attention to this and realize that these are some of the struggles that you are going through, and it's okay to struggle. It's okay to bring this up, because then if you can bring it to your forefront, it'll make all the difference in how you're going to be gentle with yourself. Because one of the top things that I see, not just with HS, is just this gentleness and this notion of gentleness with self. And I think that's very, very important, because a lot of HS isn't your fault. It isn't a matter of cleanliness. It isn't a matter of doing something wrong. It's a condition that unfortunately impacts you. And then you just need people to help you through figuring out what can you do medically. But then there's also so many other factors in there that, you hope you can have a conversation about, like, exercise, or whether it's nutrition or other parts of it. But being gentle to yourself is important. So how does HS impact us? All of you that are either know someone that's been impacted by HS or impacted directly, know that this is a condition that really affects quality of life. This is a survey they did with looking at quality of life, and these are many different skin conditions. You may not be able to see all the details here, but there's like eczema on here, acne, hair loss. And then when you look at all of those in the red, where are people impacted the most? It's study after study looking at HS. And in fact, when you look at HS and you put it along the spectrum of other not just skin conditions, but other systemic conditions like heart disease, or you're looking at stroke, or you're looking at diabetes, you can see that HS is way up here in terms of how it impacts your sense of quality of life. And so I think, this is one of those areas where we as physicians are now learning. And I will just say that it's too bad it took us this long to realize that this wasn't just a few boils in the armpits or a few boils in the groin area, but this is a systemic condition that really requires a diligent treatment plan. But we now realize that its impact is much bigger than just the skin. And in fact, it's one of the most impactful skin conditions. It's right up there with all these other conditions as well. And the problem is it affects people in the prime of their lives when they're developing socially, as opposed to a lot of these other conditions, perhaps except, say, depression, where it's perhaps later on in their life. This is early in your life and can have lasting impact. So it's so important to think about this. This is just another reflection of looking at the Dermatology Life Quality of Index ratings. One of the things that stands out to me is there are multiple subdomains. They look at subdomains to say, where do you have the most impact when you talk to patients that have HS? Where do they feel the most impact? Symptoms and feelings. Now, it's interesting that they talk about symptoms and feelings. That's just the skin directly. But look at the other things that get impacted at a very high level. Daily activities. Daily activities are something that a lot of us take for granted, but you can't with HS. And I think it's really important to bring this up to your doctor too, to say if your daily activities are being impacted, it changes the severity of how they will assess your HS. And that directly can impact how quickly they can get medications approved, or how quickly they can fight for you with insurance companies. And that's really important, because sometimes if you don't mention the psychological impact, then the severity may just be like, oh, it's limited to here, so it's not as severe because I've seen more severe people. No, the psychological impact makes a huge difference. And then personal relationships. I mean, obviously there are other aspects of this, but personal relationships are really impacted too. And that can really lead to a sense of isolation, loneliness. Again, another reason to get that treatment in place much more aggressively rather than sit and wait. And so these are all important aspects that if you can talk to your doctor about, it can make a huge difference. When it comes to pain, This is just a numerical rating scale where they look at pain. And most people, when they're rating from 0 to 10, they're rating their pain in this 4 to 8 range. And of course, we know HS has a lot of pain, a lot of tender areas. And then even itching is very high. So this is something that we probably take for granted. And we always think about the pain of HS, but the itching of HS is something that should be mentioned because this can impact sleep. Sleep impacts stress. That impacts the severity of the condition, might not allow you to work as well, might not allow you to be as concentrated during your work hours. And so again, these are all important factors that we as physicians will express in our medical notes when we're trying to talk about how severe this condition is. But it's all part of, it's not just a skin issue. We need to know about these other parts of the experience as well. Now, here's another aspect, which I think is really important to mention. The malodor, or that just the body odor that comes from HS, just from all of that pus that's draining, it really impacts quality of life too. Another factor that I try to ask patients about and make it a point to just see where people are sitting. Now, whether it's social impact or say relationship impact, it's also important to talk about itching, pain, and also that sense of embarrassment that can come from just odorous, like if you have a smell, because that is another reason to get that HS under control, because this will impact how you might feel comfortable to go to work or go on interviews or just have social interaction. So again, another factor that increases the severity of HS and makes it easier for us to fight for our patients. And you know, it feels really good to see people come back and say, hey, I don't have that smell anymore. I mean, that's a big win. So step away from insurance companies doing whatever they're going to do. Just having those little wins in the room is what makes medicine worth it for us, and probably makes it so impactful for patients that have HS that come to see us as well. We know that depression is much more prevalent in those with HS. We know that the prevalence is about 17%. In fact, though, when they compare people with HS against people that don't have HS, we know that what's known as the odds ratio, there's a 1.84 times increased odds, almost a doubling increased odds that a person with HS is going to struggle with depression or depressed thoughts. And so if you are having those sort of issues, again, remember to bring that up to the practitioner that's seeing you. Hopefully they'll ask, but even if they don't, I think it's something that we are becoming more aware amongst ourselves that this is important. But it's part of this whole, like, it's not just skin deep, it goes beyond that. And even with anxiety, we know that the prevalence of anxiety is more, it's more common in people with HS. And why wouldn't it be? I mean, if you're struggling with your skin all the time, I would think that that would lead to more anxiety. I mean, it's not just HS. I mean, other conditions lead to it. So it's not surprising that anxiety would be an issue as well. And why is this important? Well, there are ways that you can address this. It doesn't always have to be medications. There can be, and I'll talk a little bit about this, there can be mindfulness approaches. There are actual programs to help you come into a better headspace with yourself, which is so important when you're struggling, again, with things like isolation or figuring out your identity or making new partnerships or trying to figure out how do you fit in the world. All of these things can lead to more anxiety, more depressed thoughts, but there are interventions and there are ways to be gentle with yourself. So it's not just me saying be gentle. There are ways to actually cultivate gentleness. And at the end of the day, that is what's going to make a huge impact, because only you have control over how you're going to feel. The doctors can help you with treating, but at the end of the day, you still have ultimate control on how you're going to feel. And so, you know, if we can also impact those areas that are mental health based, it can make a huge difference. I do want to spend a tiny bit of time talking about intimacy and sexuality, because this is something that I do ask all of my patients. And sometimes patients don't bring this up because it's a little embarrassing and people don't want to talk about it. And sometimes it can really hurt you at your core. And especially if you're a male, sometimes this is really tough to talk about because it's not even something that is encouraged to be discussed. Or if you're seeing a male dermatologist and you're female, there can sometimes be a little bit of that discomfort. But I just want you to know this is so important. And I really think these conversations are very important to have. So why do I say this? Well, here's a question that was asked of many different patients that have dermatological conditions. And what they asked was a simple one. Over the last week, how much has your skin caused you any sexual difficulties? And if you look at all of these conditions, like you look at psoriasis, which is a full body rash, blistering disorders, which can be very painful and draining, itching that's just everywhere. You can see that people get impacted up to like 40, maybe even close, getting close to that, above 40, close to 50%. But look at HS, it's above 60%, almost getting to 70% of the people said that their skin caused a sexual difficulty. That's a lot. That's a lot of people. And it breaks my heart to think that they may not be even mentioning it to me in the room. And, you know, I didn't really make it a point to talk about these things until I really delved much more into integrative medicine and also delved a little bit more into this research. And I started to realize this is what can break people. These kind of things where you don't feel like you can be loved, or you don't feel like you can have relationships, or you don't feel like you can be touched. This is what really breaks people, because I feel like people are really strong with their skin. That can break people too, but this is the stuff where you get into hope and a feeling of belonging. That's where I think it's really important to have that connection with someone that really cares about you, like a physician that really cares, or a practitioner that really cares. And when we look at how it impacts sexuality, we know that as you have, as you are carrying greater and greater weight, the impact on sexuality is profound. I mean, even like a 4 to 7-fold increased desire. And this is not just about intercourse. This is even just you feeling sexually desirable to yourself. People like that engage in masturbation do it less often when they perceive themselves as not being sexually attractive. And I think the problem there is you end up getting into a cycle where you really don't even feel yourself as being worthy of some sort of sexual experience. And I think that also breaks my heart. And so I really try to walk that back, really try to focus in on how can we focus on treatment. And treatment isn't just medications. It brings in nutrition. What kind of exercise plans can we bring in that are reasonable so that you can really become much more holistically vital again? And I think that's really important. But it starts with having that practitioner understand where you're at today, and to understand that they really need to know where you are socially and sexually as well. And we know that the genital disease, yes, you get nodules in the vaginal area and the groin area, penile area, but it's way deeper than that. Look at some of these comments that came through. I became more, and these are from patients, I became more self-conscious. A sexual partner or someone else may possibly perceive that as a sexually transmitted disease. You know, that is heartbreaking. It's heartbreaking to think that other people may perceive you as having a disease that could be transmitted, but it's a reality. And so we as physicians have to acknowledge that this is a reality that people are facing, that are out there. And the next comment, it's affected my life in so many ways. What I can wear, what activities I can involve myself in. I don't really like to do a whole lot because I'm feeling discomfort with the stress and lack of confidence, whether it be with my partner or, and this is just the most heartbreaking part, just everyday life. And so this isn't just about, you know, the genitals with sexuality. It's the genitals with just friction from wearing clothes or sitting. I have a lot of patients that struggle with sitting at work. I mean, all of these things I can incorporate, one, to just talk to the patient to try to see if there are ways that we can address their discomfort, but also to push for whatever medications I need to, or push for whatever we need to get approved. It makes it easier for me to do that because I just push in there and say, this really is impacting someone's life globally. And so we can't just piddle around, and we really need to go after what's going to be important to get their condition under control. If you look at the impact of the genital disease on intimacy, we know that it affects many different aspects, anywhere from reduced sexual desire to avoidance of sexual relationships. And it affects people profoundly in other areas: mood or emotion, physical activities, daily activities, relationships with family and friends, of course. And what this is saying is that if you have genitals that are involved, it's of course going to affect your mood in other areas. And so I think that if you don't bring this up, it's really important to be open and have that conversation. So I had a couple tips here. So opening up conversations around hobbies, relationships, intimacy exercises. Maybe you can't do it all in one visit, but it's important to pick the stuff that's really important to you. So what do you discuss first? This is something that I teach other practitioners as well. But if you look at the reasons why people don't bring something up, is that there's a few things in here. First of all, embarrassment, nervousness. This is totally understandable. Such a personal area of the body that you don't necessarily want to talk about, but it is really important to be able to open this up. But there's also this concern of not sure the doctor will be able to help and concern about discrimination or being treated badly. Let me just start by saying, if you are seeing any practitioner that is not trying to help you in an area of the body that is private like that, or you think they're going to discriminate against you, you need to find a different practitioner, because that is part of treating this condition. So if you do have any sort of reservations, that should be something that you want to address and bring that up with your practitioner. And if you don't feel like they're hearing you, go find someone else that will hear you, because you deserve to be heard in that area. And you should be heard, because the treatment should also help to focus on making your life more comfortable, not just treating one aspect of your skin condition. The second thing, which I thought was really interesting, is how did people become more comfortable? One was if the doctor asked. But the other thing is, if it's a doctor you've seen before, so maybe you don't feel comfortable that first visit, that's okay. But that second visit, if you feel like, hey, I'm starting to feel more comfortable about things, open up the conversation, because it allows for a dialogue. And so you can build on this over time. And some visits we talk about nutrition and that's it. Or some visits we talk about gentle ways to incorporate exercise, and then that's it. And other times we'll talk about, how's their dating life going, or what are some of the things that are really affecting them there. And if I need to push for certain treatments or pursue certain things, like treat certain areas, then we do that. And so I think it's important to realize that, as we start to build a better rapport, as physicians, we feel more comfortable. But then I think that also we want any of the patients coming to see us, feeling more comfortable too. Okay, so physical activity is simple to say, okay, you need to go out and you need to start working out. And we know there are so many benefits of doing something physical, like anywhere from stress reduction to greater awareness of myself to just enhanced spirituality even. Of course, one of the tough things that needs to be acknowledged is that if you have HS and it's really painful, you have to pick your physical activities carefully, right? You can't just do jogging necessarily. If you have all of these areas that are very painful, you can't do something that's going to require a lot of friction. So one of the suggestions that I give to my patients is to think about, something like yoga. And one of the simplest things that I try to tell people is that not all yoga is created equally. We see so many things around hot yoga that can be a little bit uncomfortable for people, especially if you have HS. But there are other forms of yoga that are out there. There's vinyasa, there's different sorts of yoga that can really engage your muscles and really create a sense of exercise without putting too much friction on all your body parts. And thank goodness for YouTube. You can do this from home as well. So I tell people, just follow along with like a yoga instructor that you might just resonate with, and it might get you just off the ground. And it's a simple thing to start with. And it doesn't have to only be yoga. I mean, there are other things that you can do, things like Pilates or other things that you could engage in that could still help work out your body. Psychological techniques may be helpful. Well, there's cognitive behavioral therapy. You want to talk to your physician about this. Some people engage in group therapy, which is really interesting. But one of the things that I think all of you might want to look into, if you have someone that is struggling with this, even if you don't have HS, I think in general, mindfulness-based stress reduction, if you're not aware of this, look it up. Jon Kabat-Zinn has developed a big program around this, and it's really about becoming more comfortable with where you are today. And I think it's a really important technique to learn. It's really important state of being to incorporate into life, because we're all going to have stresses. You're never going to be in a perfect state. And I know HS is not, I mean, it's painful. Sometimes it brings up these questions of why did I get affected, whether it's psoriasis or other conditions. But there comes a point where you can start to feel comfortable with where you are today. And that is the very first step in really becoming comfortable with where you are globally. And then it makes life a lot more easy because you become more positively oriented. Even if life is throwing you all these negative things, the more optimistic and positively oriented you are, it does make a difference. But there's a way to get there. It's not just us saying you have to be more positive. There's actual techniques you can incorporate. So you can look into mindfulness-based stress reduction programs. So the key takeaways really for today that I was hoping to impart is that the psychological impact is huge in therapy. So it's not just about the skin diseases, the skin conditions, but how it affects you at an emotional level, social level, and then psychologically is very important. And the impact on your social life is important For health practitioners, no, because they can fight for different medications more effectively if they know how it's affecting you in other areas, because then that increases the overall severity of HS, that they can actually talk about and say, hey, this person needs this help more because of this, this, and this. And it won't be just because, oh, they only had one armpit involved, when I see patients that have everything involved. No, it's different. This is impacting their daily life activities. They're not able to go to work properly. It's affecting them severely in a sense of a psychological or social way. And so we need to go after treatments that are a bit more effective. And also realize there are other options there when addressing the psychological issues. Seeing a psychiatrist can be one way to do this, but there are so many other impacts in there that you can even take control of. And I do think like mindful exercises like yoga, and I talked about yoga very specifically because there's a mindfulness piece in there, but just engaging in more mindfulness is a very important way of resetting your sense of self, your sense of confidence. And I think that it makes a huge difference. And this is not just for people with HS. I mean, we talk about this with other physicians, other practitioners. Being mindful of where you're at and who you are and being like gentle with yourself is such a huge difference. And so with that, we'll open up discussions for everybody, but I wanted to just appreciate everybody for putting on this HS Summit. Thank you for inviting me. And I hope that I've engaged everybody in a little bit more thoughtful reflection on where you're at, and hopefully, help you get to a better place starting for tomorrow.
Hi, everyone, and welcome back from our break with the sponsors. So tonight we're going to address some of these fantastic questions that have been submitted by patients. Dr. Sivamani, are you ready?
Yeah, let's do it.
All right. So the first question we have is, how does stretching with yoga affect open oozing wounds?
I think this is a good question. Anytime we think of yoga, we think that there's a lot of stretching involved. And you can modify yoga. A lot of yoga isn't just stretching, it's a lot of static holds. And so you're still exercising without requiring a lot of motion. And there's a bit of, actually quite a bit of mindfulness as well. Now, if you do have open oozing wounds, yes, there may be certain positions that you have to be a little bit more careful about. And there are so many variations that you can put into this that if you are working with someone specifically, like in a yoga studio, you can just let them know it's painful for me to be in this position. How can I modify it? Otherwise, you just have to modify those certain poses where it does end up hurting more. But I think globally speaking, it allows you to exert more energy than you might realize and really get exercise underway.
Excellent. The next question is one we hear a lot as patients, and that is, what is the best way to explain HS to a new sexual partner?
Yeah, this is such a personal conversation. You'll really get to see whether the sexual partner is someone worth keeping around or not. And I know it's a tough way to say it, but honestly, they're going to have to also be understanding that, this is it's a skin condition. The way I tell patients to explain it is that this is a skin condition, much like other skin conditions that could be on the body, much like people get acne. When people get acne, they get these areas that get inflamed on the face and on the chest, perhaps, and on the back. And I think it's easy for people to understand it's like acne. And the way I talk about it is this is like acne, except in these areas where you have more sweat glands. And those areas just tend to get inflamed. And it's not a reflection of any sort of contagiousness. It's not a reflection of cleanliness. The cleanliness conversation you don't necessarily have to bring up, but I think it's more just letting them know it's like acne. It's like a skin condition that you have. And it's something that, is a disease, or it is a condition, but it's also a part of who you are. And it's something that, it's not something that you can just spread. I think that's one of the big concerns. Is this something that can get spread or whatnot? But I think you just bring it up as it's a part of who I am.
That's an excellent way to put it. The next question that we have is, how do I get my doctors to do more research on my condition so they can treat me properly?
I really hope any practitioner that you are working with is curious. And when I say that, I mean that in the fullest of terms. They should be curious in you, not going in knowing that they already know everything about your particular experience. So the way to get your doctor to do more research is for them to really like earnestly listen to your struggle and to listen to, you know, what it means to you. And now many of them engage in what's known as continuing medical education. In fact, we have a whole program that's out there that is like amongst many other companies or many other like educational endeavors where you're trying to educate practitioners. And so hopefully they engage in like the HS Foundation's educational programs, or, you know, the HS Summit is another way that, you know, a lot of the organizers that are on there are part of these educational committees. But, you know, just making sure that they're also understanding your perspective. And you know what's really a great way to get your practitioner to think about research more is to bring them something that you read and then just ask, what do you think about this? This is something that I've been reading about, and what are your thoughts on this? And it'll open up perhaps new things that they may have not have thought about, or if they already did think about it, then that's reassuring. But if they haven't, then it'll open them up hopefully to say, hey, you know, this is interesting, I can look into this. And so that's a gentle way of getting them to also expand their horizons as well.
Thank you so much. The next question that we have is, I notice many seem to get HS around puberty. I got it at menopause. Does it come at any age?
Yeah, you know, the thing about these skin conditions is sometimes we have textbook ways that we want to describe them. And then we have so many patients that don't follow the textbooks. And so the textbook is that it tends to come on when you're getting into puberty, the hormones are starting to cycle, and that's what really brings it on. But absolutely, we see people that get it later on in life, and we don't understand if that's because when you hit menopause, the hormones shift, right? There's a balance. You still have hormones, but the balance of hormones shift. And so there's another component perhaps in how your hormones can trigger HS. And so we do see a few people that get triggered for HS later on in life. A lot of them get it earlier in life, but yeah, there isn't necessarily like only one rule. All this means is that not all HS is equal, and you kind of have to treat each person slightly differently because they have different imbalances that are coming to play. But you can definitely get it later on as well.
That's an excellent point. As a patient advocate, we see it developing amongst many different age demographics, commonly at puberty, but I've also met and talked to a lot of patients who've had it start at menopause. So it's an excellent point. The next question that we have is, what types of treatments or therapy do you most recommend for those struggling mentally and emotionally?
Well, this is a pretty deep and important question, because it's got to be holistic at the end of the day. Because if you're struggling mentally or emotionally, part of it is your skin condition, right? And so we need to address that. And so there's that medical component that we have to address and make sure that we get that treated. But then, like I'd mentioned before, the emotional mental scars are the longest lasting and sometimes the most invisible. Somehow we sometimes have this fallacy of thought, especially as practitioners, where you think you've gotten the HS much better, so then everything's much better. And sometimes you've set up different patterns just emotionally or mentally that have to be addressed as well. And I think that's where that mindfulness piece is really important. But when I say holistic, I think talking about diet, talking about mind, body, mindfulness, and the medical is really important. Having all three conversations in every visit, even if it's just touching upon them briefly, is really important. And so it's not that it's a type of therapy, but I think it's more of a philosophy of taking that integrative approach that makes the difference.
Excellent. Again, the question was asked of what is the best way to explain HS to a new sexual partner. It's a pretty common theme.
Yeah. And we discussed that. So
yeah. So next we have, I'm curious if Dr. Sivamani has trained any doctors in Southern California. I'd travel to go see one.
You know, we take an approach with integrative medicine. And so there are a lot of integrative medicine practitioners that are out there. And in fact, now we have also opened up a new certificate program amongst dermatologists called the Integrative Dermatology Certificate Program. And so there are, and I'm one of the lead educators in there. And, you know, our whole principle is to get people to think beyond what they learned in their medical training and their residency, which is very medically focused and very important. I mean, you get very, very good training there. But we think that the integrative approach is also very important, thinking about supplements, diet, exercise, mind, body. And so there are a whole group of people now that are now integrative practitioners, and also like naturopathic doctors, and they're outside of necessarily just dermatologists. There's a lot of physician assistants and nurse practitioners now that are also learning about the integrative approach. And so that's something that we do on our platform. And so if you wanted to find an integrative practitioner, our platform, Learn Skin, we actually list out integrative practitioners, but look for an integrative dermatologist. Look for someone that takes an integrative approach, and they tend to be more holistic. And I think that's a way to really find someone that's going to think about you as a full person.
Fantastic. The next question that we have is, how do I find a doctor who has experience with HS?
I think the HS Foundation is a great place to start, because they keep, I think, rosters of people that are, first of all, they have a group of doctors there already that are very dedicated to HS. But if you look at like people that are around the country that are HS practitioners, the HS Foundation is a great starting point, because they can give you direction in different cities of who might be more familiar with HS. And another way to find a good doctor is to find out who's publishing. So if you put in HS and you go to like the databases like PubMed, some of the doctors that treat HS will come up, and then you'll start to see like, oh, maybe these doctors are treating HS. And sometimes doing a Google search and seeing who's writing about HS and who's talking about it, kind of like what we're doing here today, is another way to find them. But I would start with the HS Foundation. I think they're a great organization to start with.
Thank you for that. The Specialty Clinics website page on the HS Foundation is definitely a really helpful resource, and that page is expanding almost daily at this point. So many doctors have been added, and there's a vetting process for those doctors to be on that page. So on to the next question. We have, the fatigue is part of why I find the pain and social interaction so hard sometimes days. Most days, our bodies are constantly battling themselves, and the social anxiety we are facing, complete body and mental exhaustion.
I think this comment maybe perhaps isn't necessarily a question, but it's more about just expressing what HS can do to someone. And it's a unique experience for each person. I mean, some of us are extroverts and we want to have social interaction. Some of us are introverts, and some of us get so exhausted that you just don't have the energy to go and interact, and it can get very draining. And so I think you have to find someone that's going to meet you where you're at, and not come up with like a general approach that you take with every single person out there. Because when I hear this, I see that there is this fatigue and this exhaustion that comes with having to constantly fight against this condition, which to me says we have to be much more aggressive to get that condition under control, because that is really impacting your life. And so for that reason, I'd want to spend extra time to really go over what kind of medical options we have to really move forward and be more effective in our therapy. So, all I can say is I really appreciate you expressing what you expressed on this forum, and I'm sure other people can also relate, especially those that have HS. And I will tell you personally that having people come and express these things makes a huge difference to me, because it makes me feel more connected to that patient. We fight hard. I'd fight hard anyway, but I'll fight harder if I know it's impacting you that much more.
Excellent. The next question that we have are HS patients treated with medications for depression and or anxiety?
If it's really something that is affecting you, because we're all human, and many of us are going to struggle with depression, many of us are going to struggle with anxiety, and finding someone that can really address that well, because some people get so debilitated by these other mental aspects, which are also really important to treat. It's not just about treating the skin. So absolutely, you can be treated with medications for depression and anxiety, in addition to perhaps other approaches that include mindfulness. And so medications are part of the treatment approach that one could take.
Okay, we've got about 3 questions left, and this next one tugs at my heartstrings a little. I am in the UK and have to drive 2 hours to see a dermatologist that understands HS. I'm now being referred to the HS to the specialist HS dermatologist for biologicals. I'm really worried about using biologics and have done everything I can to avoid them being. Vegan for 2 years now, I've lost weight, etc. I'm so frustrated with HS and don't know what else to do. I've had both my armpits removed and a total of 16 surgeries in my arms, breast, groin, bum, and thighs on 2 types of antibiotics, dapsone, 150 milligrams, and morphine. And I can't, diclofenac,
Yeah.
for pain. Is biologics really my only option left?
First of all, I really appreciate you sharing what a struggle this is. Again, I'm an integrative dermatologist, so I always think of all of the options that are out there. But one of the things I do try to tell patients is not to be afraid of biologics when they are needed. And there are many situations where the biologics are needed, and they are safer than people might realize. And there are safe ways to do them. Now, do you need to be on biologics for life is the big question that I get. And whether you're going to be on them for life or not is something that really depends on all these other aspects that come up, like and like, if for example, if you've been vegan and you've been trying really hard, then the question is, when it comes to food, being vegan is really important because you've cut out the meat, but have you cut out, say, some of the brewer's yeast that could be involved? Or are there glycemic index foods that you could still reduce? Or are there certain herbs that you could incorporate that can then help reduce the glycemic index of any food that you take? I mean, these are all little tricks and tips that we walk through when we're talking about food. It's not just about going vegan, but it's like, what does that mean? What are those foods that you're actually eating? Like dairy, for example, obviously that would be gone being vegan, but there's still other aspects that could still flare HS. But at the end of the day, no matter how hard you're working, at some point it isn't necessarily always, it's not your fault because you didn't get a good enough diet or you didn't do all the right things. Sometimes your body's genetics is just in a place where you're still inflamed. And that is where biologics shouldn't be something where you're surrendering and saying, like, I'm losing this battle. No, you should look at biologics as, here's another way that I'm going to regain control. And that control is very important, because once you get that control, then you have the opportunity to work on all these other aspects of your life that might help you not to have to be on the biologics for a long amount of time. But I don't want you to look at biologics as a loss or a surrender or I failed. It really should be, here's another option that can help me succeed. And that's the way I look at it. And honestly, being on biologics would be a lot better than being on long-term antibiotics, which is affecting your gut microbiome and affecting the good bacteria. Biologics don't have those impacts. And, we're learning more and more about them. And so, they have a very important role. And I think they have a very good role in treating HS, and especially in people that need it. And I'm really sorry to hear the struggle that you've gone through. And I really think in this kind of a situation, this is where, you having the opportunity to go on biologics may actually be the thing that you need to really get over that hump.
I can't thank you enough for some of the comments that you made in the answer to that question. I think sometimes as patients, we take on a lot of the blame and the treatment protocols, and we think that it's our fault when something fails. And so thank you for your kind words. I know as a patient, I really appreciate it, and I'm sure those watching feel the same. But we did have a follow-up question to this that's kind of along the same lines. So we had someone ask, what are biologics?
Biologics are one of the miracles of modern science. So what we've been able to do now is, when we look at the body sends off signals that can cause inflammation. And in HS, for example, one of these signals that causes HS is something known as tumor necrosis factor. Now, originally, we called these signals certain names because we knew they did certain things, but now we know that those signals have greater impact. So tumor necrosis factor originally was because it went and killed tumors. But we know that this signal actually can create inflammation in the body elsewhere. And in HS, it's at very high levels. And it's one of the drivers of inflammation that's causing your body to go into these boils and have all these pus pockets develop and the pain that comes from there. So what a biologic is they've developed these medications now that can target those signals very specifically, which honestly is amazing that we can do this. We used to originally, when we try to suppress the immune system, you just kind of try to suppress everything. But now we have like these pinpointed abilities to go after one signal. And so with the biologic, for example, adalimumab, which is FDA approved for HS, it targets tumor necrosis factor, TNF alpha or TNF. And by doing that, you can basically block what TNF is doing in the body selectively and thereby reduce the inflammation in the body. It's just fascinating, because even if you think of herbs, let me take a step back. If you think of herbs, I do a lot of herbal medicine, or if you think of foods that are anti-inflammatory, they're never this pinpoint. They're more broad, and you're hoping that in that broadness, you'll be able to reduce the inflammation. Well, what's been amazing about these biologics is you go after this one molecule and you're actually able to make a shift in the condition by neutralizing that molecule. And to me, that is just absolutely fascinating that we're able to do that. And it's a powerful way of being able to regain control that never was available to people even 15, 20 years ago, where people really struggled without having any sort of sense of a medication that could do this. So that's one example of a biologic. They're creating more and more biologics now and they're studying them in the research setting, going after other signals to see, hey, can this work better or can that work better? But it really is a marvel of modern science. And, as an integrative practitioner, hats off to these researchers that have figured this out, because it has given us way better ability to control HS in a lot of patients.
So we are right at 8:10. We have a few more questions. Are you okay if we just wrap up with these last few?
Of course.
All right. So the next one we have is swimming a good exercise while having HS?
I think it's a fantastic exercise when you're having HS, because it offloads the body so that you don't have as much stress on it. The buoyancy of the water can make it so that when you're moving, you get less friction just naturally from the water. You don't have as much friction when you're moving. And you're in a state where perhaps if you're outdoors and you're very careful, you're getting a little bit of vitamin D. Don't forget your sunscreens, broad spectrum. Don't sunburn yourself. And you get to be outside. You get to be a little bit social. You don't have to be isolated in your house all the time. So, I think there are many different reasons why swimming is really good, but I think it's a low impact exercise. I think it's a great way to get exercise.
Thank you. So the next one is, my mother had HS in her face really bad. She didn't leave the house and her life was very small. I don't have HS very bad, but my daughter suffers with it terribly. How does it skip a generation?
I'm so sorry that your mom and your daughter have been dealing with this. When you have HS on the face really bad, you just want to be sure it's also not really terrible acne that could be addressed in a different way. So I would first just make sure that that's getting addressed, because HS and acne run together in circles, and some people get bad acne and some people don't. This whole skipping a generation, it really does feel like it, doesn't it? If your mom had it and then your daughter has it. HS is what we'd call a complex landscape. So it doesn't necessarily skip a generation, but in your particular case, it did skip you as in terms of the severity. But we know more holistically that sometimes it can affect certain siblings and not other siblings. And, why is that? We're still working on the research. We also know that, you have certain genes, but there's also something known as epigenetics, which is that, the environment that you're in or the foods that you eat or the stress that you have can also impact what genes are getting expressed. So some component of it is genetic, some component of it is going to also be the environment. And so it's a little bit more complex. So it's not that it skips a generation. It's more that, we can't predict necessarily who's going to be impacted or not. But when we see someone get impacted, we try to really lean in and help them.
Excellent. The next question that we have is, can a dermatologist prescribe medication for anxiety and depression?
Well, it depends if the dermatologist is comfortable in that space. But typically when it comes to anxiety and depression, that is usually the expertise of either a primary care physician or a psychiatrist. Now, that being said, there are many supplements that could be safely incorporated, especially if the anxiety is not severe or if it's mild. There are certain ways that you can approach that. However, I do think that if depression really is a concern or if anxiety is debilitating, we try to bring in other experts to help with this. But it all depends on you have the conversation with your dermatologist, and then you can decide, what the right next steps would be.
Okay. What are a few herbs to consider using?
Yeah, when it comes to herbals, it's definitely not a one size fits all. It really depends on each person that's going to be there and what the intent of those herbs are. So let me first start by saying the herbs are not FDA approved. None of the herbs are FDA approved, and so I think it's important, just ethically speaking, that we have that conversation, that the FDA approved medications are like one of those biologics, adalimumab being the biologic that's approved. So it's important to understand that these are not FDA approved. They're considered dietary supplements rather than a medication. And it's to augment perhaps any anti-inflammatory effect, or if you're trying to help with diet, as an example. There's an herb that I try to incorporate. Now, depends if you have diabetes, depends what kind of medications you're on. We also have to watch for interactions between the herbs and your medications. So it's hard for me to say one size fits all, but I'll tell you some of the effects we go after. Some herbs are anti-inflammatory. Some herbs have been shown to be effective for acne. They haven't been shown to be effective in HS because the studies haven't been done, but I'll still incorporate them because I know that if they already have some level of acne, that it can be helpful there, and it may help their HS as well. There are other herbs that help reduce the amount of glucose that you absorb. If you have carb cravings, there are certain herbs that can reduce your carb cravings. So that makes it easier for you to have an approach to nutrition that fits, because sometimes we're trying to reduce carbs. You're trying to reduce things that might flare your HS. So if I can get an herb on board that can help reduce those carb cravings, I've been able to help people, kind of get away from that. I don't want to mention specific herbs here because, if you want to discuss herbs in more detail, come see one of us as an integrative practitioner, and we'll be able to walk through them because it is a bit more personalized. And I think that you also have to watch for these drug-herb interactions. So I don't want to just do a one-size-fits-all and then you're on the wrong kind of a medication and have an interaction. We don't want that.
All right, and our final question for the evening is, does Dr. Sivamani have a book or publication?
If it's on HS, we have published some things in the medical literature. I don't have a book that I've written necessarily generally about HS. We have a whole platform called LearnSkin, learnskin.com, where we talk a lot about many different conditions, and HS is one of them where we explore it in detail. And we have a symposium that we put on to teach other doctors. It's called the Integrative Dermatology Symposium, where we do a lot of integrative education. So we do a lot of educating. We do a lot of educational programs. And if you wanted to come learn more about HS2, it's easy for you to access it. Some of it's really directed towards other practitioners, but we never say you can't come on and check things out. It's it's free to join. If you're not trying to get credits or anything like that, yeah, it's much of the information that we have is open reading.
Excellent. So this concludes our second night of the HS Summit. I'd like to, on behalf of the patient community, thank you, Dr. Sivamani, for spending your Thursday evening with us.
Of course.
And educating us on the psychosocial impacts of HS. Just a reminder to the patient that this recording will be on the SpotMe platform for the duration of the summit. And then another reminder is that the next session, night 3 of the HS Summit, will be on January 25th. Starts at 11 a.m. and that topic is exercise and wellness. So with that, I hope everyone has a fantastic evening, and thank you for joining us on night 2. Good night, everyone.
Thank you all.